Welcome, everyone. Welcome to our Gift of Health Tuesday Total Wellness. And I am so excited for today's session because I have a clinical psychologist with me. So, if you or any of your loved ones are experiencing any mental health conditions or addictions, this conversation is for you. So, make sure you let your friends and family members know and join us for this conversation because this is going to save lives. And today's guest is Dr. Jonathan Stea. He's a full-time clinical psychologist and assistant professor at University of Calgary. He specializes in addiction and mental health treatment. He's also the author of the brand new book, Mind the Science, Saving Your Mental Health from the Wellness Industries. And we are so excited for his book. You will get to know more about his new book, where he dives deep into the dangers of mental health misinformation and pseudoscience. Like Jonathan he's actually a two-time winner of the University of Calgary's Award for Excellence in Clinical Supervision and co-editor of the book Investigating Clinical Psychology. He has published extensively as a science communicator, and he has been featured in many outlets, including CBC, Toronto Star, National Post, and he has appeared in numerous mainstream media, television, and radio outlets. And we are so excited to have him with us. Welcome, Jonathan. And we are so excited that you are here.
That was quite the intro. Thank you so much for that and for having me today. I'm happy to chat.
Oh, thank you so much. For those of you who are new to this community, I'm Dr. Shobha Rayapudi for those of you who are meeting me for the very first time, and I actually help people struggling with chronic diseases, including diabetes, high blood pressure, heart disease, to break free from those diseases, reduce your dependence on medications, and have more energy. And today I'm so excited to have this conversation because, like, we see so much mental health, and I would say more than 80 to 90% of the patients that we see in the clinic is because of stress and mental health that happens. And this is like one of the factors that is also causing chronic diseases. So Jonathan, what inspired you to write this book?
Thank you for that. I and I was inspired to write this book because, as you mentioned, mental health is a huge concern for all of us. Everyone's been touched by mental health or illness in some way, whether it's a friend or family member or ourselves. And we need to be able to address it in healthy, evidence-based ways so that people can get the care that they need. Unfortunately, the landscape of mental health out on popular media, social media, and our healthcare institutions is imbued with mental health misinformation and pseudoscience. And that's a huge problem that I've been kind of battling on social media for over 5 years now, as I've really seen mental health misinformation and pseudoscience explode. And that's a real problem for anyone suffering with mental health and illness because the wellness industry itself is really the Wild West when it comes to navigating that space. It's hard to know what is an evidence-based treatment, what is a non-evidence-based treatment, what is fact from fiction when it comes to mental health claims. And so people were messaging me for years trying to help me, trying to ask me to help them solve those questions. They asked me things like, is this article legitimate? Or is this guy a quack or a grifter or a snake oil salesman? Or is this treatment bona fide or legitimate? Or will it help my loved ones? And so after years of trying to answer these questions as best as I could, I really wanted to compile a resource to help people understand and answer those questions for themselves. And that was the spark for the book. I wanted to be able to empower people to take their mental health into their own hands so that they could navigate that mental health terrain and be better positioned to figure out what is true and what is false when it comes to mental health claims that we see everywhere in our culture.
That's interesting. So, what are some of the most common myths about mental health that you come across?
Well, it's hard to pick just one because unfortunately it's kind of like playing that arcade game whack-a-mole because one pops up and then you knock it down or debunk it and they keep sprouting up. But there's a lot of repeated themes or tropes that I'd say that have appeared throughout the decades. One, unfortunately, that we have been seeing lately on social media that's been amplified by a lot of what I'd call bad actors or big players is kind of sparked by what I describe in the book is the anti-psychiatry movement, which is sort of a movement against kind of the medical field of psychiatry. And it has kind of a long history, which I may or may not go into. But essentially, the claims that you'll hear from people is things like mental illness doesn't even exist. You'll get guys like Andrew Tate, who's a very popular person in the US who will tweet to hundreds and millions of people that depression doesn't exist and that it's only for, and I'll use his words, fat old men, lazy people. And that is a very stigmatizing way of talking about people who experience mental health difficulties. And it's also just scientifically wrong. So that's one thing. And then you also get guys like him or even say Elon Musk tweet or post to hundreds of millions of people that psychiatric medications are more harmful than they are helpful for people. And again, that's an inaccurate way of portraying things because obviously we want people to get the best care that they need. And not everyone who experiences a mental health difficulty needs to be on medication, but there's also a lot of people that do. And trying to fear monger about them and to spread kind of propaganda about whether they work or they don't is a really big problem. And that problem ends up showing up in our clinics where people are scared to try this stuff because of misinformation that they've heard online. So if someone's suffering from, say, schizophrenia, or they're hearing voices or a psychotic disorder, our first line evidence-based treatments involve psychotherapy and pharmacotherapies for that person. And they need to discuss that treatment plan with their psychologists and their psychiatrists and their treatment teams. And they shouldn't be persuaded by influencers online or people that are selling unsupported treatments or protocols that don't have any science behind them. And so those are some of the common ones. I'd say mental illness doesn't exist. Our treatments that are evidence-based aren't actually evidence-based and don't work. And that can be very harmful for people.
Oh, yeah, that's scary too. So, can this misinformation lead to harmful self-diagnosis or self-treatment?
Absolutely. Yes. I mean, there's something called the illusory truth effect, which is a psychological phenomenon. It just basically means that all of our brains aren't very good at differentiating familiarity from the truth. Meaning, the more time that we see and we hear misinformation, the more likely our brains are just to believe it. That's just a psychological phenomenon that we have. And we have um, evidence, empirical evidence, scientific evidence that false information online spreads further and faster than the truth. And when people are seeing and they're hearing this kind of misinformation about mental health, that can negatively impact their mental health decisions. So do they seek treatment or not? Do they accept evidence-based treatments or not? And then, like you said, even online, there's tons of misinformation just about self-diagnosing, and people may diagnose themselves. There was a recent study that came out that analyzed the most popular videos on TikTok about ADHD. So there's lots of videos on TikTok. Some are about ADHD. This study found that the most popular videos about ADHD on TikTok that had advice or information in them, about half of them were wrong, and those or misleading. And those videos were viewed millions of times. And similarly, I took part in a study where we looked at the most popular videos on TikTok with the hashtag mental health. So videos that had a hashtag mental health, and they got really popular. we found that about a third of those videos were misleading, but those videos were viewed billions of times. And so that just shows how far-reaching mental health misinformation can be. And again, back to that illusory truth effect, if people are repeatedly seeing these videos over and over and they're sharing with their friends and family, they're more likely to believe this stuff. And again, that can impact health decisions in a bad way.
Yeah. So, can people distinguish between reliable mental health advice and misinformation? Or does your book help to do that?
That's the goal. And it's a tall order. It's a hard goal, but it's one that I'm trying to help people with because even health professionals like you and I, it's that can be a really hard task. It's hard to, you know, sift fact from fiction when it comes to areas outside of our expertise as well. But one of the things that I do in the book is trying to help teach people how to develop their science literacy skills and their mental health literacy skills, which means being able to understand science a bit more and mental health a bit more so that they're better prepared to be able to tell fact from fiction when they encounter a claim. And I also try to help people I try to teach the language of what I call pseudoscientific grift, or the language of pseudoscience, so that people know when it's spoken, because pseudoscience is essentially the heart of the wellness industry, unfortunately. And that's what can lead to people buying in and literally financially buying into pseudoscientific treatments and emotionally buying into it, and that can be harmful as well. So I try to teach people essentially how to spot science, pseudoscience and how to avoid its lure. But it's hard. It's a very hard thing to do.
Yes, and it's amazing that at least someone like you is trying to help people distinguish that, because it is so important to know the reliable mental health advice versus misinformation, because as you said, there are so many dangers of this misinformation. So, like, what are some of the common mental health issues that you encounter in your clinic?
Well, in my clinic, I happen to work in a public health sector in kind of a hospital in Canada. And my clinic is a specialized clinic. So we treat people who experience what is called concurrent addiction and mental disorders. So what that means is someone would come to our clinic if they're experiencing moderate to severe addiction problems, and they have another kind of mental disorder on the side, or diagnosable mental health concern like anxiety problems or depression or post-traumatic stress disorder or psychotic disorders. And then they would also be experiencing an addiction as well. So an alcohol addiction or cannabis addiction or an opioid addiction or sleeping pills or methamphetamine or cocaine or whatever that is. And I work on a really fantastic interdisciplinary team with other psychologists and social workers and nurses and psychiatrists and addiction medicine physicians. So we do individual psychotherapy, evidence-based treatment. We do group therapy, and then we do pharmacological therapy as needed in consultation with physicians and psychiatrists.
So, like, coming to, as you mentioned about anxiety and depression. So, as a clinical psychologist, what would you say, um, like, can help anxiety or depression? Because that is some of the things I would say, like most of the population experiences that. Is there something that we can do about it?
Yeah, and it's a complex topic
Yeah.
because anxiety and depression themselves can be kind of an umbrella term, meaning anxiety can encompass a lot of different things. There's kind of non-clinical anxiety that I experience and you experience and lots of people experience. And then at some point, though, it can be more severe and pathological. And the way that we do assessments for that, because if someone's really concerned about their mental health, where their anxiety is getting in the way of their functioning and their responsibilities, like their school, their parenting, their work, whatever it might be, and it's super distressing, it's worth getting an assessment, a mental health assessment by a psychologist or another kind of mental health professional to see if what they're experiencing is a kind of mental disorder or not. And there's different kinds of, say, anxiety disorders. There's social anxiety disorder. There's agoraphobia or panic disorder. There's generalized anxiety disorder. So there's different kinds, and different treatments will be able to help different kinds of disorders. That said, there are certain things that everyone can do, whether they have a mental disorder or not, that can be helpful for things like anxiety. And that's kind of the basic, I would call lifestyle interventions, as you guys do. And we do even in our clinic. I run a lifestyle group every week for people who experience a mental disorder. So getting back to basic self-care activities. So things like trying to their best, and it's hard when someone has a mental disorder like depression or anxiety, but trying their best to find a helpful exercise regimen and eating healthy and nutritious and in nutritious ways, having a good sleep schedule, cultivating their relationships, and also finding meaningful pursuits and meaningful things to do. So those are some kind of basic foundational things that we need. Sometimes, though, when people experience severe addiction or mental disorders, that is sometimes not enough. And then we need kind of more evidence-based treatments like one-on-one psychotherapy work, and in some instances, pharmacological interventions as well. But it's important to get a psychological assessment to kind of know where someone falls.
So, how is your book, or what is that your book can help with?
The goal, so there's a lot of false claims in, like I mentioned, the wellness industry. And so if we go onto Instagram or we go onto maybe a random wellness clinic website that may say they can treat your depression or they can treat your anxiety or the post-traumatic stress disorder, but the way in which they're telling you to do it is by basically parroting a narrative, which I also talk about in the book, that is unhelpful, which is that mainstream medicine doesn't know what they're doing and they get it all wrong. And in fact, we have the solutions, the influencer or the grifter, so to speak, and their protocol, whatever it might be, whether it's supplements that they have or a specific dietary protocol or another kind of pseudoscientific treatment, maybe it's a gadget or a kind of talking therapy, that they'll be able to treat someone's depression or anxiety or PTSD or addiction. And there's no scientific evidence whatsoever to support that. And in fact, sometimes they can be harmful. So what my book tries to do is to try to help people figure out, are those claims legitimate or not, and to try to point them in the direction of where to get actual, real, scientifically informed care, evidence-based care.
I mean, that is so helpful because it's so important to know where to get that reliable information. So, what would you say? How prevalent is mental health misinformation?
Well, I think it's huge, unfortunately. As I kind of mentioned, like with those TikTok studies, I mean, it's these are videos that are being viewed millions of times, and in some case billions of times, and that's just on social media. And I think that again, it's sort of infiltrated popular culture as well, as you get kind of either celebrities or again influencers parroting these tropes, and that has kind of ripple effects. Maybe I'm kind of speaking out of turn, but I'm going to do it anyway. If we kind of go to the US politics, we're seeing an absolutely devastating approach to
Yeah.
healthcare right now with RFK Jr.'s administration. That's my view, where there's a lot of misinformation and propaganda being spread and actually legitimized and institutionalized in the US. And I think that's going to have devastating repercussions, which we're already seeing now with things like the measles outbreak, and that will also translate to worsened mental health.
So, would you say like people encountered this misinformation mostly in social media or other outlets, or are there any other places too where people encountered this misinformation?
I think it's everywhere, unfortunately. It's like I mentioned, it's baked into our culture. So it's in movies, it's on TV shows, it's in conversations that we have with friends and family members. And it's no one's fault. It's almost like memes. It's how memes spread. They're themes and ideas that kind of get transmitted over time. And so it really shows up everywhere. And even in our healthcare institutions themselves, you can find psychologists and other even bona fide health professionals practicing particular kinds of pseudoscientific treatments, which again, I try to call out in my book as well. When you look into the world of mental health care, you'll find it's been estimated that there's at least 600 different kinds of brands of psychotherapy, which is a ridiculously huge and growing number because the vast majority of those 600 brands of psychotherapy haven't even been evaluated scientifically. And many of them could actually be harmful. And so that's another way in which it can show up even just in our healthcare professions.
Oh my God, that's so scary. So then how can the general public become more critical consumers of mental health information? So what is that we can do?
I think it comes back to trying to adopt an attitude of being skeptical, not cynical, but very skeptical of claims that we encounter. And then again, in the book, I try to help people or point to how people can improve their science literacy and mental health literacy, because that can be very protective for people. And then also learning the pseudoscientific warning signs and the tropes that I'm talking about. So, for example, in the book, I mentioned 9 pseudoscientific warning signs. And so trying to figure out whether a particular claim or a treatment is pseudoscientific, it's not an either or, either pseudoscience or not. It really comes down to more of a probabilistic endeavor, meaning the more warning signs that we see and that we hear, the more likely it is that we're seeing something pseudoscientific. So I outline nine of those warning signs, say, and I think that if people can start to understand them and even memorize them if they can, I mean, I've had to do that myself, then I think people are better positioned to protect themselves from those kinds of claims that we see.
That is amazing. So, so right there, I mean, like it's so important to get this book so that we can protect ourselves from this misinformation and understand more. So, what would you say? What steps can mental health professionals take to counteract misinformation?
That's a really good question and a super important one, because when it comes to mental health professionals, at least with clinical psychologists, but I would say all bona fide mental health professionals have an ethical duty to practice evidence-based care. And what I mean by that is it's in our codes of ethics. When mental health professionals get licensed, when I become a licensed psychologist or licensed social workers or licensed psychiatrists, we have codes of ethics that we have to follow and what's called legal standards of practice. So there's certain ways that we have to practice. And in those codes of ethics, it says that we have to practice from an evidence-based philosophy or an evidence-based lens, which means we need to pay attention to the science or mind the science, which is what my book is called. So what that means is that we need, from mental health professionals, need to pay attention to the science, because science is an evolving thing that happens over time. And good mental health clinicians or good mental health professionals will keep apprised of the scientific literature, and they'll know the more evidence-based ways to practice versus the non-evidence-based ways to practice. And they should be doing that from an ethical standpoint. Unfortunately, I think the reality is much more dismal. I don't want to be so pessimistic, but I don't think all mental health professionals practice in ethical ways. And our regulatory bodies are supposed to crack down on that stuff, and they don't, for a number of reasons, in part because there's a big gray area between what constitutes pseudoscientific treatments or not. But there's also very crystal clear examples where I think that mental health professionals are practicing unethically by providing pseudoscientific treatments. And well, my view is that that's an unethical thing to do. And I think regulatory bodies could be a bit more stricter in that respect.
Amazing. We have a question in the chat. So Helen is saying access to psychiatrist is the main issue in Newfoundland, or like when people have difficulty accessing mental health professionals. So what is that they can do?
Oh, that is a really, really important question, and it really does hit the nail on the head because one of the reasons that people turn to, say, wellness influencers or pseudoscientific grifters is that exact issue. There's a lack of access and lack of availability to evidence-based care, whether it's a psychiatrist or a clinical psychologist or other kinds of mental health professionals. And to be frank, I wish I had the solution for that. I don't pretend to know the answers at the policy level or the social level, because those are in essence policy and social level problems. And so I couldn't, I'm actually quite transparent in my book, is that I don't have those answers. My book comes at it from the level of the individual and the level, because that's the level in which I practice as a clinical psychologist, seeing patients one-on-one. I'm trying to empower people to help themselves, to protect themselves from that onslaught of stuff that we're seeing. But I completely agree that we need a multi-pronged solution, and the book is only one of them. We need also much better policy, and beyond saying vote for people that actually have mental health care in mind, and who will increase access and funding and resources to mental health. That's the way forward. But I don't know. I don't have any more concrete answers than that.
The other question we had is, can you offer us some tips? Like if we have a family member who is facing addiction, so like what are the steps that we can take?
Yeah, that's a tough one, because yeah, lots of people can be touched by addiction and mental health concerns. Um, the tips that I would say is that, for the most part, and this is an unfortunate reality, because when we have loved ones that are hurt by addiction, we obviously feel that pull. We want to help them. We want to do everything that we can. Sometimes we maybe even be tempted to force them into treatment. Unfortunately, that can sometimes have a backfire effect, because when people experience addiction, sometimes they go through different stages of what we call their readiness to change, which means someone is not always ready to make those changes, and they might not necessarily even see their addiction as a problem. So that can be really tough. From a family member or friend perspective, I would say that one of the best things you could probably do is to just show up for the person by expressing concern, expressing care, expressing empathy, and just letting them know that you're there for them, to help if they wish to have help, and just kind of trying to express that care and concern in a very, again, I would say non-confrontational way, but more from a perspective of, I care about you, and I want to help you if you need that, and how can I do that? So that's a very tricky dance to do, and it really depends on someone's, what we call the interpersonal dynamic that they might have with the person. Some people may be offended by that regardless, but sometimes it's hard to also bite our tongue and watch someone hurt themselves. And so I would say that that's sort of the best approach, is to just be authentic and be genuine with respect to your care for the relationship and your care for the person.
That is a wonderful answer, Jonathan. So, like if we obviously, I mean, as family members, we genuinely care for that person, but as you said, we may not have the skills to deal with it. So, like we can definitely say that we are there for a person, but in terms of accessing help, like what resources are available? So, let's say if we want to find help. For our family members facing addictions, so like how we can, I would say, increase our awareness or knowledge about it, so that like we can help our family members.
Yeah. And unfortunately, it somewhat depends on the jurisdictions or the places that people are located, because the mental health resources will be different depending on provinces or states or locations, or depending on where people are. But one way in which you might want to start is that usually, at least in Canada and the US, there will be professional associations. So things like the Canadian Psychological Association or the American Psychological Association, or in Alberta or in Ontario, there's there's different province associations. Like, so I would encourage people that that can be a good place to start, because when you go to the web pages of those often credible sources, you'll find things like fact sheets, to learn about mental disorders and their treatments, and or even resources about where to kind of get help. So that's kind of one avenue you can do it. Another avenue is to actually try to reach out to like, I guess, your local treatment teams or your healthcare providers. So a family physician may or may not know a psychiatrist or a psychologist, or have mental health resources that they could share that are more specific to the place that we live. So for example, I'm in Alberta, and we have a wonderful triage system called Access Mental Health. So if someone has a mental health concern, or a concern for their family, they could call this line, and then on the other end of the line, they'll get a social worker or a mental health professional who can talk to them for about 15 minutes or so, or half an hour, and then they'll be able to direct them where to go to get the appropriate help. I wish everywhere had that kind of service, but I just don't think that's widely available. And so you really want to get to know your local kind of availability of services.
Oh, that's really helpful. That's interesting. So it's great that Alberta has that central line where people can call. So would you say, like, does every province have that? Does every province have a central line to call?
I don't think so, unfortunately,
Okay.
and that's a big, again, policy problem. Mental health and addiction treatment has been notoriously disjointed and underfunded, I'd say, for decades. And
Mm.
so that's another kind of real problem, again, that drives people into the hands of, again, I'll use the term grifters, who will sell them a bill of goods that actually are unsupported and unhelpful. So, there's parallel problems here, unfortunately.
That is so true. So, like, we are pasting the link for your book in the chat. So, uh, like, people can buy it in Amazon, and could they buy from your website as well?
Yep, they can buy from my website, they can buy from Amazon, and if they're in Canada, we have chapters or Indigo, it's there as well. So, um, yeah, because we're in Canada, that's why I'm plugging that. But
Amazing.
yeah,
Yeah, amazing. So yeah, so for people living in Canada, like, definitely, like, you can get this in chapters and Indigo as well. And we have pasted the link in the chat for you to grab. As you can see, like, mental health misinformation is so prevalent. And like I would say this book is kind of a savior in terms of at least knowing uh, like how we can differentiate this misinformation, and like even at a personal level, like it is going to equip us, like first of all how we can differentiate, because there are so many dangers of unverified mental health hacks. And as you said, and sometimes people tend to believe that because they go so viral, and like protecting ourselves from it is, I mean, it's the first thing, but also like helping our family members and other people is also like it's going to save a lot of I would say mental pain from our end as well. So thank you so much for, I mean, writing this book, and so that like we can help ourselves with this mental health information. Would you like to add uh, anything, or like why do you think it's important to buy this book?
Thank you for that. It's important because it was, writing the book, at least for me, was a way to try to provide a kind of mental health support that you're saying in a way that I can't do as a clinician. Because as a clinician, I'm treating people one-on-one, we're doing psychotherapy. I'm not trying to teach people how to debunk misinformation or pseudoscience, but because I can't do that, that's not what we do as clinical psychologists at a one-on-one level. But the book was a way to try to help people get that mental health support in a different way to try to reach a wide general audience. And like you said, my intention with it was to help use it as a tool or a shield to protect against that kind of onslaught of bogus claims. And I'm hoping that people will find it helpful in that way. And that's why I wrote it. So
Yeah, thank you so much. So that I mean, and that's so important to know because as you said, there is so much bogus information, there is so much pseudoscience out there, and this book can help us to delineate that. So I know like writing books is not so easy. So
oh, thank you. Can
yeah.
can I say too, I'd like to add just briefly that, and it's not about like blaming and shaming people too, because everyone is human and we're all when people experience health concerns, including mental health concerns, desperation can be very intoxicating. Everyone wants their ailments to be healed, and everyone sometimes falls for fake science news. Everyone falls for misinformation. So it's not about blaming and shaming people for that. It's about calling attention to the harm that that can do and trying to help people protect against that or to mitigate that harm and point them to a place that can actually be helpful.
So well said. Yeah.
Thank you.
Thank you for like guiding us there. So any other last thoughts? So any other last thoughts or advice that you would like to give to our audience?
From my perspective,
Mm-hmm.
I think I like the mantra of being skeptical, not cynical, which means when we encounter various claims out there, whether any kind of health claims, but including mental health claims, just trying to check the source, ask yourself, is it credible? Ask yourself, is there a hidden agenda just in terms of are they trying to sell me something? Is there science or evidence to support what they're saying? And just to kind of have that skeptical lens because again, unfortunately, the mental health world is what I would call the Latin term is caveat emptor, which means buyer beware.
Mhm. So thank you so much, Jonathan, for your time. And like if you guys have any questions, so feel free to put it in the chat and we can ask Jonathan. And like we have pasted the link here for you guys to grab the book. And like if we are yes. So, okay. There's another question in the chat asking, my son, he is uh, experiencing substance abuse with the pills. So, like, what are the steps that I can take to help him?
That's tough. I'm sorry to hear that. That's really tough. And there's various kinds of pills. I mean, so it would kind of, in part, it depends on what he's using. There's opioids and benzodiazepines, or there's stimulants and things like that. But regardless, I would
So they're
say that
saying it's stimulants. Yeah.
stimulants, yeah.
Okay.
So regardless, again, I would kind of go back to maybe, expressing concern, trying to address it with him, and just in terms of that caring kind of perspective. Um, and then also trying to even see if he's open to help. Is he open to talking to a mental health professional or a health professional about that, which may or may not be a problem. Again, it really depends on the person, but it's important to try to get a foot in the door, to try to get a health professional who can do a proper assessment, a health assessment or a psychological assessment, to see what precisely is the difficulty and how best to remedy or help with that. But again, we can't force people to do that either. And so I empathize and understand that very that difficult way of navigating that situation. If he is open to it, that's great. And then again, I would ask a family physician for a referral to a mental health professional, ideally a psychologist or psychiatrist.
Thank you so much. So thank you so much for that information, Jonathan, and thank you so much for your time. This was so enlightening. I would say that this information was so interesting, as not many of us are aware of the mental health misinformation that is present out there. Like I know, like in wellness industry, there are so many myths floating around. Uh, but it is also quite interesting to know how much misinformation also exists in the mental health platform, which is really dangerous. So thank you so much for making us aware of that.